There's a team of local surgeons changing the way doctors treat breast cancer.
They're working together in the operating room to make sure surgery a whole lot less invasive. Now, they're pulling this off in the new state-of-the-art breast center at Westside Surgical Hospital.
The goal here to keep the whole patient in mind, from their emotions to their finances and their time.
I had recently just had my first mammogram.
Jessica Witherow is an advocate for her health and has always performed monthly self-breast exams. That's why she was shocked about the results of her very first mammogram.
Very surprised because sometimes you just can't feel the tumor.
She was diagnosed with stage 2 breast cancer. Jessica is relieved she underwent a 3D mammogram at Westside Surgical Hospital. Studies show 3D images can often catch cancer years before a traditional mammogram.
So my treatment options were to either have a mastectomy or a lumpectomy were basically my two treatment options, and they said that the outcome for both is equal, so you could choose whatever you're comfortable with. And so for me, I chose the lumpectomy.
She was able to spare her breast tissue because of this powerful trio. This team consists of a breast radiologist, surgical oncologist, and reconstructive plastic surgeon who work together side by side in the operating room.
Before the surgery, I draw a map for the oncologic surgeon in order to guide them through the that they remove the tumor from that I will use for my reconstruction.
I'm the breast radiologist, and my part in this team is to usually see the patient when she arrives for her day of surgery.
Dr. Melissa O'Toole helped place these wires around Jessica's tumor.
And by placing the wire with the ultrasound guidance, it allows Dr. Templeton to know exactly where to go and what part to remove.
Which minimizes how much I need to cut into the breast or how much breast tissue I actually need to remove. We allow them to get a better cosmetic look and to be able to preserve their breast.
My involvement mainly is after Dr. Templeton removed the tumor and performed basically the reshaping and reconstruction of the breast. But in order to achieve the result, I review the radiologic finding with the radiologist. I discuss this with the other members of the team.
It's marrying two older procedures together to come up with a better cosmetic look, but still something that's very oncologically sound.
Dr. Shenaq says under a traditional lumpectomy, it is not cosmetically repaired during tumor removal. Then patients often undergo radiation, making it tough for plastic surgeons to repair the damage later. This new concept allows the breast to look as normal as possible with only one procedure. And Dr. Shenaq often operates on the other breast to make sure the breasts are symmetrical. Jessica is pleased with her results. She's a teacher who was warmly welcomed back into her classroom after recovery.
They all screamed when they saw me and rushed toward me and grabbed me and hugged me.
Jessica felt ready to go back to work, she said, after only 2 weeks. Wow. So remarkable recovery, but she ended up taking off a month to fully recover. Insurance does cover this procedure. It's
meant for fairly early stage 1, stage 2 cancers. Doctors say they believe it helps the patient financially, physically, and emotionally. All of those things vitally important.
So you do have to realize there are so many different components of this, and when you take care of all of them and you have this team, it works out really well. So it's great to see what's going on over at Westside.
It's awesome.
Yep, pretty proud of it.